Chapter 16, Receiving Payments and Insurance Problem Solving. The learning objectives for Chapter 16 are: 1. Identify and discuss 3 health insurance payment policy guidelines. 2. Assess reimbursement payment timeframes for all submitted claims. 3. Identify the components of an explanation of benefits document and interpret and post an explanation of benefits document to a patient's account. 4. Discuss secondary insurance and guidelines to billing secondary insurances. 5. List and describe 3 health insurance claim management techniques. 6. Explain reasons for claim inquiries and identify strategies to discover why payments are delayed. 7. Define terminology pertinent to problem claims filing and discuss types of problems as well as find solutions. 8. Identify specific reasons for rebilling a claim. 9. Describe situations for filing appeals and discuss the review and appeals process. 10. Review Medicare's 5 levels in the redetermination appeal process and determine which forms to use for each level. 11. Review and discuss the TRICARE review and appeal process, including expedited and non-expedited appeals, as well as reconsideration. 12. List 4 objectives of state insurance commissioners. 13. Mention 7 problems to submit to insurance commissioners. 14. Discuss the type of information necessary to include in an insurance commission's request. And 15. Explain the importance of claim denial management. The Claim Policy Guidelines. The policy guidelines differ by insurance companies. With the development of proficient skills and experience in following up on claims, an insurance biller can become a valuable asset to his or her employer and bring in revenue that might otherwise be lost to the business. Some examples: claimant must notify insurance company of a loss within a certain period. If a disagreement occurs, the suit must begin within 3 years after the claim was submitted. The insured person cannot bring legal action against an insurance company until 60 days after the claim was submitted. The insurance company dictates the guidelines for claim submission, either as the insured, the electronic claim submission, the capitation contracts and fee schedules, and reimbursement timeframes. Many companies prefer or even require that all claims be sent electronically. Reimbursement timeframes. Payment time limits vary by payer: 4 to 12 weeks for paper claims, 7 days for electronic claims, and your managed care plan can vary in payment schedules. You'll contact the insurance company if payment is not received in a reasonable amount of time. The state insurance commissioners can help obtain late payments from different carriers depending on the state. Explanation of benefits. The EOB states the status of a claim as either paid, adjusted, suspended or pending, rejected, or denied. The EOB is also can be referred to as the remittance advice, a check voucher, or a payment voucher. A suspended claim is a claim that is processed by the third-party payer but is held in an intermediate pending state about payment either because of an error or their need for additional information from the provider of service or the patient. The EOB will also state the allowed and the disallowed amounts. It should be provided with a payment check if applicable. Some of the components on an EOB will be the insurance company's name and address, the provider of services, the dates of services, service or procedure, the CPT codes, the amount billed by the provider, and reduction or denial codes or comment codes. The explanation of benefits, or the EOB, is a starting point to understanding and addressing outstanding or problem claims. You'll want to study the details of the EOB line by line. Reduction or denial codes include comment codes with reasons, marks, or notes indicating reason payments were denied. Some additional components on the EOB is the claim control number, the subscriber's and patient's name and policy numbers, analysis of patient's total patient responsibility, co-payment amount that might be due, deductible amount subtracted from billed amounts, and the total amount paid by insurance carrier. Secondary insurance. Secondary insurance cannot be billed until the primary insurance has paid. Blocks 9A through 9D of the CMS 1500 should include information about the primary insurance that paid the first part of the claim. Block 30 of the CMS 1500 should reflect the balance after the claim was paid and the amount exceeding the allowable limit is written off. Depending on the state contractor, Medicare will automatically forward the claim it paid on to the secondary insurance. Reimbursements from secondary insurance should be designated separately from primary insurance payments on a patient's account statement. Paid claims that have an outstanding balance should be kept aside to monitor secondary insurance payments. Claim management techniques. A spreadsheet software program can help generate an insurance claim register that is easy to update. Most efficient ways to purge patient accounts is to run an aging report and remove all accounts that have zero balances. The electronic practice management system can run a monthly aging report to identify which claims are still outstanding. The insurance company payment history system can help avoid potential problems. The insurance company name and regional office addresses, claims filing procedures, payment policies, time limits for claims and payments, dollar amount for procedural codes, and patient names and policy and group numbers. To track the patient payment history of insurance companies, use software or a manual system. Include the information listed from the slide. Be sure to keep the names of patients and their policy and group numbers current. And it is easy to see which insurance companies pay slowly and pay less for certain services, and it provides reports for tax purposes or determine financial trends. Claim inquiries. Claims inquiries should be submitted in writing whenever possible. They happen when there's no response for 30 to 45 days. Payment was not received within a contractual time limit. Incorrect payment was received. The amount allowed, patient responsibility are not defined. Payment received for incorrect patients. The EOB shows changed code. The EOB shows a disallowed service that was a benefit. Claim needs revision and resubmission. The EOB has an error, or payment was made out to the wrong physician. When calling to inquire about a claim, you want to document the date, time of the call, and the name of the person spoken to, along with a short outline of the conversation. Problem claims. These are some types of problem claims. Delinquent, payment is overdue. Suspense or pending, non-payment caused by an error or the need for additional information, etc. The medical office will encounter many types of claim problems. You should have a procedure or plan to respond so that the claims can be settled. To prevent repeated claim errors, if the office manager understands and has a good overview of the insurance claim process, he or she should identify the source of the errors within the medical office. For potentially lost claims, sometimes a backlog on the insurer's part results in the lack of response. You can send a copy of the original claim to the insurer, but be sure to make it clear that you are not rebilling. A claim might be rejected if it does not follow all the insurer's instructions. You can submit a corrected claim to address the problem. Denied claims. Denied claims are often denied because they do not meet the criteria in coverage policy. If a claim is denied, you want to know the reason. Was a diagnosis not covered? Was prior approval for treatment required? If a claim is denied, inform the patient and work with the physician to address the problem. Downcoding can mean that the insurance carrier has downcoded the claim, thereby reducing reimbursement. The procedure or diagnosis code submitted on the claim was general and unspecified. Be sure to read through all the procedure notes and provider orders to determine the most specific diagnosis code related to that patient's condition. Payment made to the patient. If an insurance payment is sent to the patient instead of the provider, it can occur for two reasons. Either the provider is considered out of network from the patient's health plan, or the assignment of benefits was not signed by the patient. The solution would be to call the insurance company or visit the online web portal to verify whether the payment was made, to whom, for which the dates of service, the amount, and the check number, and the date of issue. Underpayment. It is important that the insurance billing specialist perform random checks and monitor large claim payments made during the first 3 months of a new contract to ensure that the third-party payer system has a contracted payment fee schedule correctly loaded into the software. Track the charge, the allowables, deductibles, and paid amounts to determine whether the amounts are correct. If claims are unpaid, print the incorrectly paid claim and send them by mail to the third-party payer's contract negotiator to be resolved. Ask him to re-adjudicate the claim based on the agreed-upon contracted amount and include a letter with the claims. An overpayment is a sum of money paid by the insurance company or patient to the provider of service that is more than the account balance or more than the allowable amount. Overpayments can happen for a variety of reasons, and handling them can be challenging. Overpayments can happen for any of the following reasons. A payment was made twice for the same date of service. A payment was made that was greater than the contracted allowable. A payment was made for a patient and date of service that does not exist. And a payment was made for a service that was not performed for a specific patient. Preventing denied claims. Denied claims occur for many reasons, so be proactive to try to prevent or minimize them for your practice. You want to verify insurance coverage at the first visit. Make sure the demographic information is current at each visit. Include progress notes and orders for tests for extended hospital services. Submit a letter from the prescribing physician documenting necessity when ambulance transportation is used. Clarify the type of service. And use modifiers to further describe and identify the exact service rendered. You want to make sure that you keep abreast of the latest policies for Medicare, Medicaid, and TRICARE programs by reading local newsletters. Obtain current provider manuals for all contracted payers, including the Blue plans, Medicaid, Medicare, and TRICARE. Put bulletins from these programs in their manuals so they're up to date. Rebilling. With rebilling, do not rebill a payer without investigating why the claim is still outstanding. Rebilling without investigating it could create a duplicate claim for the same service. Corrected claims should be resubmitted. You want to send a correction notice with that corrected claim. Patient bills should be sent out monthly. Some of the claims with minor errors, such as missing identification numbers, etc., can be rebilled instead of having to go through the appeal process. Review and appeal process. Some of your appeal situations might be that payment was denied, payment is incorrect, physician disagrees with the insurer, unusual medical circumstances, pre-certification not provided, inadequate payment and complicated procedures, or deemed not medically necessary. When you can't address a claim problem using the basic measures, you may have the option to appeal by making a formal request for a review. You want to consult the physician to see if this is a good idea. If you appeal, you must follow the laws and regulations surrounding an appeal as well as the insurance procedures. Collect all your documents and call the insurance claims representative or adjuster to find out how to resolve the problem. Appeals are not just to fix minor errors. They are meant to challenge the outcome of the claims process due to a discrepancy. Filing an appeal. You want to send a letter explaining the reason why the provider does not agree with the claim denial listed on the EOB. Put together excerpts from the coding resource book and attach a photocopy for the article or pertinent information showing the coding resource and date of publication. A peer review is an evaluation done by a group of unbiased practicing physicians to judge the effectiveness and efficiencies of professional care rendered. This can determine the medical necessity and subsequent payment for the case in question. Send copies of similar cases with increased reimbursement from the same insurance company, if available, from your insurance company payment history file. Call the insurance company and speak to the person who handles appeals, explaining what you want to accomplish. Send any correspondence to that person as well. And you'll want to keep copies of everything that you do. Medicare review and the redetermination process. Each insurer may have its own appeal process. Because Medicare covers so many patients, become familiar with its appeal process. The first thing you'll want to do is a telephone review. And after that is the first level of appeal is a simple inquiry. In these cases, you might just be able to solve the problem by submitting a corrected claim. Moving up to a higher level of appeal, a physician may ask for a review of a denial of a Medicare Part B claim. This can be done with a letter and a government form. To progress to the next level of appeal, the physician may feel that the review is unfair and request a hearing on the matter. Some hearings, depending on the amount in question, may be requested from an administrative law judge. A Social Security Administration also has appeals counsel if you feel the judgment was not lawful. Finally, in costly and controversial cases, you might appeal all the way to the federal district court. The appeal system progresses in levels. The administrative and judicial approach has advantages for the insurer, the physician, and the patient. With the Centers for Medicare and Medicaid Services regional offices, one final suggestion, and this can be done with steps for a hearing or a review, is to write or telephone the medical director at one of the CMS regional offices. Sometimes a regional officer intercedes and takes steps to correct the problem or the inequities. The CMS regional offices may be located by accessing the Medicare website. Medigap. Insurance companies that sell Medigap policies must be certified by the state insurance commissioner before being allowed to sell in each state. The certification can be lifted from any insurer that does not honor its contract agreements. TRICARE review and appeal process. TRICARE has its own level of review. Keep in mind that appeals procedures for TRICARE contractors may vary. There are two types of TRICARE appeals, the expedited and the non-expedited. Your expedited appeals must be filed within 3 days of the receipt of the initial denial. Non-expedited appeals must be filed no more than 90 days after the receipt of the initial denial. Reconsideration is conducted by the claims processor or other TRICARE contractors. A formal review is conducted by TRICARE headquarters, and a hearing is administered by TRICARE but conducted by an independent hearing officer. Commission objectives. Regulations vary widely from state to state. To make certain that the financial strength of an insurance company is not unduly diminished. To monitor the activities of insurance companies to make sure that the interests of the policyholders are protected. They'll want to verify that all contracts are carried out in good faith. And to make sure all organizations authorized to transact insurance, including agents and brokers, are in compliance with the insurance laws of the state. The insurance commissioner will review policies to determine whether the denial of a claim was legal or not. Some additional objectives is to release information on how many complaints have been filed against a specific insurance company in a year. To help explain correspondence related to insurance company bankruptcies and other financial difficulties. To assist if a company funds its own insurance plan. And to help resolve insurance conflicts. Now, the insurance commissioners do not have the legal authority to order an insurance carrier to make a payment. Types of problems. These are the type of problems that you should submit to your state's insurance commissioner. Improper denial or underpayments. Delay in claim settlements. Illegal cancellation of a policy. Misrepresentation by an insurance agent. Misappropriations of premiums. Problem with premium rates. When two companies try and decide on who is primary. Commission inquiries. Everything related to insurance claims and filings has to be done according to the procedures. If you submit a request to the insurance commissioner, it should include all of the following information: the patient's, the policyholder's name, address, and phone number, the insured name, the insurance agent, the complaint, patient signature and date, the insurance company, policy or claim number, and date of loss. Now, there are some methods that could be used to speed up payment from a continually slow paying insurance company. Copying the insurance carrier on letters to the insurance commissioner, and rating the carrier with the commissioner's office. And this concludes the lecture of Chapter 16, Receiving Payments and Insurance Problem Solving.